Good morning, John.
Alpha Day, good morning, Sabrina and Chris and Jason and everybody over at KOAM and the link. So I know I missed last week, but there was a lot going on. So, we are still, I guess for everybody, just an update, we're still operating in cohorts, as everybody knows, and that's really been helpful to us in returning to in-person instruction. But our end goal is to return for 5 days of instruction as soon as possible. So it's been calm out on the school sites, and we're thankful for that. At the same time, we're tracking all that we can with the community transmission rates, working with public health to really determine when hopefully we can see a return to 5 days of instruction for all of our kids. And I'm a little frustrated. As I track these trends myself, looking at where we are, I get excited every time I see a dip in the number of cases. Yeah. But then the next day it might go up. So of course this is not a day-to-day thing. This is really looking at long-term trends. So we've seen the decline from maybe mid-September, where I think everything peaked, but it just isn't improving fast enough for my liking. We wanted to get our kids back to school on a regular schedule as soon as possible. I know our board supports that, but it really is going to take some continued improvement in these cases that we're seeing out in the community. I also wanted to let you guys know, I know you've been asking about the reporting of cases at GDOE. So we're in our third week, starting our third week back, and so we started to put out the daily reports at the end of the day, and then on Wednesdays we'll be releasing a weekly dashboard to basically kind of sum up and share what we're looking at at the central office level in trying to do assess the safe conditions at schools. So one of the challenges, though, and I think I communicated this earlier, is that in the first 2 weeks, actually during the shutdown, our parents and students have been very good at reporting when there's a positive case that's affecting them or their household. And so what's happened is that we get reports from online students, we get reports from households where students hadn't been to school because we were shut down. And then even in these first 2 weeks, trying to sort through the information that we were receiving from families, it's been even up to Monday, we were receiving notifications of positive cases that we then go confirm with public health. And then when we begin to do our contact tracing, we confirm that not every case that's being reported. In fact, the vast majority of the cases that were reported in the first 2 weeks were not at the school sites. So for us to issue the reports, it's been very important for us to work with our nurses, work with our school administrators to really determine that for every case that is reported, and again, we're thankful for the reports from the households, from our families, but what we're trying to give our families is an understanding of what risk might be present at the school sites. Meaning that a student who tests positive or an employee who tests positive was at the school site during the time frame in which he or she tested positive. And the data really hasn't been very clean the last couple of weeks, and we're starting to get a handle on it this week. So I just wanted to assure you this week and going forward, we think that the data that we are producing is more directly reflective of what we're seeing at the school sites. I think what's happening, just so for my assessment, is that especially since we initially shut down, there's been such an increase in household spread that what's happening is when there's a positive case identified in a household, the entire family may be quarantined as an immediate precaution. And so even if the student hasn't tested positive, they're already in quarantine before they get tested positive. So when we finally get a positive test notification, we'll go and we'll try to figure out who the contacts are. Then you realize, oh, they've been quarantined, for several days already, and we're never at the school site. So that's not for all cases. There have been some cases where we've had to do contact tracing at the schools, the parents and the, of those families or of those affected contacts, are all notified through the same process. But we haven't been able to put together a district-wide summary until we were able to kind of clean the data. So, but I think we've got a handle on it now. We've been trying to sort this out with our nurses and schools. And so, like you saw in our initial report on Monday, we had 13 cases, student cases that were reported. And, yesterday, then at night, after we sent that report out, we got some of the information from the nurses saying no contact tracing needed. They weren't even at school for the last, 14 days. So, it's been a challenge, but I think we've got a handle on it now, and we want to make sure that we bring everybody along with us during the, this tracking and monitoring of the COVID-19 situation at our schools. So just an update on that. And of course, I think I mentioned before, we meet weekly on Tuesdays with public health, their contact investigation unit, just to go over the numbers and to provide some comfort regarding what they're finding, whether there is any risk or concern about spread at schools, or whether these are in fact cases coming from the community spread, which has been ongoing for a while. So to date, there continues to be confirmation from public health that they're not seeing any evidence of school spread, even in schools where you're starting to see cases that are more than a couple during the first week. So we're good with that, but of course we've asked that we continue to have those regular consultations just to make sure that even as we get the numbers, we're checking in on what they're finding through their investigative work, so that we're comfortable with what we're presenting. So I'll go ahead and stop there and take any questions you might have at this point.
Before we bring in Isaiah, because I know he has some questions, I wanted to ask about this resolution that was passed by the Guam Education Board on the 7th related to the finances over at GDOE. So it looks like there's a shortfall in appropriations, or can you kind of break this down and what sort of austerity measures that we're looking at for GDOE?
Sure. So, I think the bigger context is that since fiscal year 2018, as you might know, DOE has taken about, somewhere between a 12 to 15% cut due to a number of factors. Back then it was the federal tax cuts that went into effect in the middle of our fiscal year, and we had to go through a cost-cutting exercise already. And then, of course, now that just when we thought we might turn the corner, COVID-19 hit, and we know that the overall, island's finances are kind of shaky because of the economy, because of the shutdown, and we've also had to deal with shortfalls in cash in terms of property tax and so forth. So we already understood it would be a difficult budget. What we did going into the budget discussions was, first of all, to prioritize meeting the maintenance of effort requirement. And so we worked with the legislature to make sure that at the very least, make sure we maintain the maintenance of effort, which requires that 30%, requires that a proportionate share of government spending, which is about 30%, be dedicated to education in order for us to maintain access to the federal dollars that are coming in to support our recovery from COVID-19. So, based on the appropriation, we believe that the maintenance of effort will be achievable, once we get through the rest of the year. Now, that doesn't mean that we're not, that we haven't had to adjust due to the appropriations cuts. So we went down about 4.7 million this year, and as we were analyzing the cumulative impact of these budget cuts, the board wanted to make sure that we maintain our fiscal discipline, and in the analysis basically said, look, this is how much it costs to cover our current staffing pattern, meaning all the employees, most of which are warm bodies, actual people in their jobs. This is how much it costs, about 187 million to support our schools. The rest of these funds are going to go to the operations and utilities needed to operate. We recognize already that we're about a $20 to $30 million shortfall on the operational side. And so, I think what the board wanted to do is to assure the employees that, you don't have to watch over your shoulders. We're not, going to go into furloughs immediately because of the budgetary challenges. What we're asking is that the superintendent review the budget and look for additional areas of savings or look for additional revenue sources to plug the gap that will enable us to pay our utility bills, pay our contractual obligations, and so forth. So that's the budgetary situation. There is a gap that needs to be addressed, and the board asked me to come back in 30 days to inform them of what actions are taken to be able to close that gap. And again, whether these are cuts or whether these are new revenues, let them know what that plan is. And if there's a need to go to the governor and to the legislature for more resources, then that would be, an opportunity at the end of these 30 days to clarify what that need is and to go forth and seek that additional support. So that's my task. That's something that on top of everything else, we're doing. I feel optimistic. I mean, I think, number one, one of the things that we're going to be doing is going through what we're calling, it's called a cross leveling of our employees and staff based on our updated student enrollment numbers. So we'll be releasing these official numbers this week, maybe today, hopefully, or later this week. But we're going to be probably midway between 26 to 27,000 students, which is about a 2,500 student enrollment drop from 2 years ago. Most of that drop took place last year as we started the pandemic. We were shut down. So we were kind of wondering about those numbers and whether they would sustain. And we saw an additional decline, at the start of this school year as well. So we're not sure yet. We're still doing our research to kind of try to go back and track what we know about the students who have left. But we do know that with 2,500 students, less, that we need to take a look at maximizing our classrooms because we haven't adjusted our staffing pattern to reflect the reduction in students. So we're going to go school by school. Our school administrators are scrubbing their budgets to see whether there are adjustments that can be made in light of less students enrolled in our school. So that'll be the major exercise on the one hand. On the other hand, we are working with our team inside our federal programs team to look at whether federal funding can be used to plug that gap now that we know what the budget is. Mm-hmm. So we'll be looking at that, looking at ways to hopefully get GDOE's approval to be able to address certain areas of spending that would be in line with the federal grants, but would also help relieve some of the local challenges that we were experiencing. So
Jon, just to dumb this down a little bit, just going back to this resolution, are we looking at a $45 million shortfall? Is that what we're looking at?
The $45 million is based on what we expect to incur in a normal school year, based on our current staffing pattern and our current our past operational needs. But again, some of the adjustments that need to take place will have to be looked at in the next 30 days. So that 45 million anticipates full staffing with the enrollment that we had a couple of years ago. So I do think that number is going to be can be reduced. And then also looking at the other costs that we have, if there are going to be any savings due to the fact that we are not quite operating in a normal year, that will be factored in as well. When we budget with the expectation that we're going to be 5 days a week. Everyone's going to be at school, and that's what we would need normally. If there are any savings that come about because of the differences in operations, then that'll be factored into it. Otherwise, we're looking at whether it's our federal funds that might be able to be used or the resources that have been given to the governor to offset the revenue challenges that the island has faced in general. We think we'll be able to get to a solution for this year. The problem is this is we won't have federal funds forever. The challenges that we see are challenges that were likely to show up next year and the year after. So no matter what we do to solve this year's challenges, we're going to need to get a head start on ensuring that we don't have a similar situation going into the next budget year as well. So it's going to be an ongoing, discussion. Let's, take care of this fiscal year, which I think we can, but then, start to look ahead to the next fiscal year. If we don't see any recovery in the economy, if, these federal funds are not going to be available to be used, we're going to need to, find solutions much earlier in the process. So again, that's just a highlight for what the next year will look like in terms of reviewing our budget.
Okay. Isaiah, I think he had a question for you. Isaiah?
Good morning, Superintendent Fernandez. I do have a question in regards to the COVID cases. You guys reported 13 students testing positive on Monday. Then yesterday, you guys reported 1 student from Munchinana Elementary School testing positive. I was wondering if you could clarify as to the dates of when these students tested positive. This is the 3rd week students have returned for in-person instruction.
Right. So, like I explained earlier, those cases would have been reported over the weekend and reported on Monday. So again, we were working. We're coming back from a time when we were all shut down and at home. It's been very difficult to sort out the cases being reported that require contact tracing or no. I mean, we weren't getting the information as timely as we needed, because once we returned to school, people were calling the offices, the nurses, and they were kind of chasing down the cases to try to confirm, get the confirmations from public health. And once that confirmation is received, going and doing the contact tracing. So the first couple of weeks was a little chaotic because, as you know, with the community cases at a high level, we were getting information about cases that affected students, but not every one of them. In fact, like you saw yesterday, of the 13 cases that were reported, 12 cases weren't on campus during the time frame in which they would have tested positive. So they presented zero risk at the school sites, except for the 1 student at Munchinana. And again, I didn't get that information until late in the day, and we've worked yesterday to try to figure out how do we, ensure that we're getting that information regarding whether the student who tested positive was on campus at all during the time frame in which that positive test would have presented a risk, to other students or employees because they were at school. And so it's a strange situation because we didn't encounter this at the beginning of the year, but now because the spread of the households are much higher than they were about a month ago, we're finding that whole households are in quarantine already before the students test positive. So they may have already been out of school, for the prior week, and then got a positive test, and now are required then to stay quarantined for additional time. So again, it hasn't been easy to sort through those cases. But again, after the first couple of weeks, after continued discussion with the nurses and public health, we're hopeful that we're able to confirm these numbers prior to every evening's report. And I think my team tells me that they think they've got it kind of worked out. So we'll see how it goes this week. Again, we're not trying to be public health by reporting all the cases we know about, because if there's an online case, a student who is online who's positive, but they're not coming to school, that's something that public health can report on if they like, as one of the many cases. But it certainly doesn't present a school-based risk, which is what we want our parents and our community to be aware of. That if a student was at school in a congregate setting, they had tested positive and they were at school during the time frame in which that positive test is identified, then we want to make sure that parents are aware, hey, there's a case. And we weren't able to do that very cleanly in the past couple of weeks. Some cases required contact tracing. Majority of cases that we heard about came back later saying no contact tracing needed. And it was at that point I said, I don't know that I'm comfortable reporting information that we're not really certain of. So I hope that, we've been able to, utilize the public health data to this point to kind of keep tabs on the risk in the community. But we're going to be able to do our part this week and keep tabs and keep the community informed of what we're seeing as schools, school-based risks based on what we're learning from our families.
Isaiah, are you good?
Are we still on track to releasing the weekly dashboard today?
Yes, we are. So again, we're going to be releasing that every Wednesday morning. Again, one thing we're trying to do for this first, re-release is to kind of clean up that data so that we make sure that what we're reporting it really is relevant to what I think our stakeholders want to know, which is positive cases at schools versus positive cases for students who have not been at school. So we're trying to do that. And again, I think we'll get that out, clean that data, and be able to push this out before noon, so that we can share it with our community. I hope that we'll have an opportunity as well later this today or later this week to go over that, so that you're clear on what we're doing. So when you report it, you can also have a good, accurate understanding of what we're trying to communicate. What we do is we track overall numbers, then we track the numbers at a school level, and so that you can take a look at where those cases are. We're updating our vaccination rates from what we know, and providing what we know from our consultations with public health. So we'll try to give that on a weekly basis to kind of sum up what we're seeing. And what's different from the day-to-day report is that these weekly summaries are going to give us an understanding of the bigger trends that we're seeing in the department, and will be contributing to our discussions about when the right time will be to reopen schools for all students to return and go back to 5 days of instruction.
Isaiah, are you good? Okay, I think he is. So
I'm good.
Okay. I know that he's got a meeting with DOE, a briefing with you guys later this afternoon. So, John, I wanted to follow up on interscholastic athletics, because there's a deadline that's coming up. It's this weekend, I want to say, the 18th, for all organized sports, training all the coaches and students to either be vaccinated, I believe, and or is it submit to testing? How on track are you guys with this?
Yeah, so we'll be getting our report on Friday. So all teams have been informed. So every athlete 16 and above is required to be vaccinated or to submit to weekly testing. And so those numbers, again, should be, they're already being collected, but we're going to get a district-wide report on Friday to confirm all those numbers. Coaches as well are required to meet that requirement as well. So we'll be able to update when we get to Friday. Additionally, our season is starting, and so we saw the guidance coming out yesterday about organized sports, and there should be just a clear distinction. I think the guidance says this is organized sports, but this is not meant to be the interscholastic sports guidance, and there's a separate set of rules for interscholastic sports. I just had a conversation with Director St. Augustine this morning, and I said, our athletic directors are hoping to align these rules, because our coaches and our athletes both compete in interscholastics and organized sports, and we'd like to have maybe similar requirements so that we don't have to clarify this for parents and other folks. One of the key things that we are asking it's a new request, but it really is to extend the vaccination requirements for spectators that are already in place for organized sports to interscholastics. And the reason we think this is important is, again, the student athletes are required to meet this requirement. The coaches are required to meet this requirement. All GDOE employees are required to meet this requirement. So the athletic directors are wondering, why is there no requirement on the spectators who will come to the games and cheer and be there to support the students? We should be similar across the board. So we're working with public health to try to align those requirements between organized sports and interscholastics. So our first games, I believe, start this weekend. So hopefully between now and then, we can have that discussion and try to make that happen.
Just for clarification, in order for interscholastic sports spectators, they must be vaccinated or not vaccinated?
No, currently it's really a limit of 4 spectators per athlete. So that's something that the athletic directors have been planning around. But There's a difference between the different venues. We have some gyms are smaller, some are larger. So we've given the flexibility to the athletic directors to further refine those limits if they find that the gym is too small to safely accommodate the number of participants that are authorized. So that's something that we feel comfortable doing. But when it comes to vaccination requirements, we do think that that's a public health responsibility and decision, and we certainly don't want to start making up rules ourselves. So I asked our San Augustine this morning whether they would consider extending that, just so that we're all in line together. We are organized sports. We take place in schools, but the safety precautions probably should be the same or even higher when it comes to our students and employees.
No, I hear you. It was kind of confusing when you have the outside leagues, then you have the interscholastic sports, and then the rules are
right.
completely
And
different.
Our athletes do both, right? They do the community league, they do the school leagues. But when they first saw that guidance, I think the initial guidance back in early September or late August, I think it actually resulted in a whole bunch of student athletes going to get their vaccinations. So, it accomplished that goal early on. But now I think we're not going to have an issue with compliance. It really is just making sure that everybody understands the rules and there isn't any confusion.
And so let's move into this testing plan that was submitted by all of the schools, actually. So have you gotten any feedback from public health on the testing plan, the reopening plan?
So, of course, we sent our reopening plans to public health. And again, we have 41 schools, and yesterday the update was that 34 of them had already been approved. And so they're just going through them, trying to catch up with all 41. But we expect all of them will be approved, and we know that public health's environmental health unit actually has been out at our schools, just showing up, unscheduled to do their monitoring, and we welcome that. We welcome them to visit and give us their review and let us know how we can improve. And so that's been a real productive partnership with public health. So hopefully by next week we'll see all of those reopening plans approved, and we can go from there. When it comes to testing, even though we have a plan, we still have not initiated the employee testing, and that's something I followed up with Director San Augustine today. So for us to do that, we're estimating about 300 employees weekly, meaning these are employees who have opted not to take the vaccine. And so these are employees who only had the first dose. And then there are some, employees that were waiting to get their official response. But we're estimating up to 300 per week. So the three things that we needed in order to implement was, number one, making sure we had an adequate number of test kits to be able to take us through the next couple of months. And that's been delivered by public health. We need a standing order from public health to authorize our nurses to administer and to report on COVID-19 test results to public health. So that's something that's forthcoming, and that's a typical, authorization that we would get for any type of, communicable disease testing and so forth. So the standing order we expect. And then the third thing is to get an official designation for DOE schools to be able to test on site versus employees going to, government designated sites outside of the schools. We're trying to minimize the disruption to our, school operations. We're trying to build the flexibility in that we can test, employees without having to stop school or do it on a weekend. And we've been talking with public health, and I think that's a workable plan. We just need a couple of the formalities to be completed. So Director San Augustine and I spoke this morning to get that done so that we can begin next week with the employee testing component. And then, of course, once we get that under our belt, move further into how we want to approach the requirement for student testing.
Right. And so you said check test kits. You got enough. Check for the standing order. Check for the designation,
Yeah,
right?
yeah,
So.
those 2 points need to be addressed, but
Mhm.
I think if we can do that this week,
Mhm.
then we can commence next week. And that means that the testing for employees will be happening at the school sites. The nurses will be able to
Mhm.
say, "Hey, listen, this is the time you need to come in, we'll do the tests, we'll work on on getting you the results, and then we'll be able to do that on a weekly basis. Because like I said, we have about 114 trained individuals to administer the Abbott Binax Now tests. So that's what we're going to be doing for now. Again, my understanding is that we're going to eventually shift to another rapid test, because I think the Abbott's Binax Now tests are going to be expired by the end of November, and they're no longer in production. So my understanding is public health is working to procure another kind of rapid test that hopefully, if everything works, it'll be the salival test, which I think everybody going through the testing will appreciate more than the nasal test. So we'll look forward to confirming that once we get that from public health.
But so just what about the student testing? I mean, that's going to still be required?
Well, there is an executive order and public
Yeah.
health guidance on that, and that says that within a 90-day period, so looking towards the end of the year, there should be screening testing implemented with the goal of random student testing of about 10% of the population. So, that's a goal. There's I think a lot of further discussion needed regarding number one, to ensure that the screening testing is being done according to the appropriate public health expertise. And second of all, that we can work that out logistically to make testing 2,700 students on a regular basis is going to take some planning and organizing to do so. And that also takes into account that that there is going to be a consent required, as far as we understand it, before we can administer any tests. So it's going to be like more along the lines of offering the testing, the screening testing for our schools. If parents or students who are majority age don't consent, then we would just need to we would move on from there to someone else who's willing to do it. So we don't see anything, we don't see any forcible testing as part of this plan. It's really a matter of us trying to figure out, what tests will be available for that effort. What is the appropriate way in which we should administer tests? How frequent do these need to occur? And then once we identify, that piece, how do we administer the test to 2,700 students?
And that's every week. That's every week.
Well, I don't think that's going to be every week. I think people recognize that might be obviously tough. But if it's once a quarter, even, we still need to figure out whether that's in line with recommended, public health guidance. Not just public health here, but we're reading FDA and CDC guidance on what would be effective screening testing. So I think this is a lot more that we have to discuss and learn before full implementation begins, at least on our end.
Right. All right. Well, thank you so much, John. Was there anything else that you wanted to get out to stakeholders, to the community?
Well, hopefully we'll be able to pick a date. We're still planning for an October job fair. Like I said, as we scrub the budget, we'll be able to say, here are the actual positions that we'll be able to fill. Maybe it won't be as lengthy as what we were initially planning, but we're hoping we are planning to have it in person. We think that I think there will be a virtual option, but in person is usually what we're used to and what we think we can do safely. But we're still working out the details. Most likely it'll be typically like the event, like use of Eventbrite or some type of platform to schedule your appointment, to come in, make sure your application's done. When you come in for interviews, we'll be able to run through that process and then hopefully make sure we fill some of those critical positions, especially the ones at the schools. So again, we're in the final stages of planning, and once we identify that date, it's going to take place on a Saturday. We're targeting I guess not this week, but maybe the following week as a potential date. But we'll make that announcement and get the details out to everyone once we just put that plan to into a final form.
All right. Thanks a lot,
Thank you, John.
All right, thanks guys.
All right.
Take it
Stay
easy.
Have a
safe.
great week.
There you go, Superintendent Jon Fernandez. With our Wednesday check-in there, Wednesday, October 13th, 2021. Good morning. Let's take a break, guys. A whole lot to unpack from that interview. We'll be right back with more of The Link next. Good morning.